let's just start off. How about if we all give you, a minute or two, just to introduce yourself. Dylan, you already done, so we don't do that. We'll start over. Introduce yourself and kind of how long you've been here in the area and kind of what your role is, what you're doing. You want to start, please? Dylan's already started, so yeah, we'll go with Faye.
Hello, hi. Well, welcome to sunny Las Vegas, where it's not sunny. And I am so honored. You do not know, the core of me is so excited to be a part of the Black Men's Brain Health Conference. And no, I'm not Black, and no, I'm not a man. If you can't tell, but I have so much passion. The community gets together, shares ideas, perspectives, lived experience. I am Kat Hartley. I've lived in Las Vegas since '99, but I came from the South, and the South showed me what inequality looks like, what it feels like, how I can love my neighbor and see what I saw. And that coincides today with my family history of losing 7 family members to Alzheimer's disease. I've had it in every decade of my life, and I decided to commit my professional career. I was a pharmacist, but U-turned right into the FDA and worked on drug products that we use today. And I came to Vegas. Oh my gosh, my career was over. My neighbors, somebody mentioned they had a pole in their living room. It was a big change from the East Coast to here. I thought that my Alzheimer's career was over, and lo and behold, they build the Cleveland Clinic Lou Ruvo Center for Brain Health in this journey. And I ended up volunteering there and worked there for almost 10 years. I advocated on Capitol Hill for Alzheimer's issues. And now I recently just retired from the Cleveland Clinic because I'm caring for a special needs brother who has some cognitive challenges and a stroke and other things, and my mother who's at the end of life. So I just bring to you my heart, my personal story, the caregiver's journey, sort of the research side, and then my love for community, which segues into this amazing person. Yes.
Good afternoon. Thank you, and thank you for that, Kat. I'm Byron Goins, 60-year resident of Las Vegas, grew up in North Las Vegas. I am currently the director of the Martin Luther King Jr. Senior Center, where it's a great day every day at MLK. Had to get that in. We are one of the premier senior centers in Southern Nevada. Just a little bit about me. Not born here, but born in Los Angeles, here since I was 3 years old. My family is a mainstay in the community in North Las Vegas. My parents are retired educators. I have a school named after them, the Goins STEM Academy. We are all graduates of HBCU. We like to call it the Prairie View A&M University of Texas, where we proudly have graduated from. My youngest sister, Pamela Goins Brown, the first Black mayor in the state of Nevada. She won election last year as well. Yep. She followed in my dad's footsteps, who was retired vice mayor of the city of North Las Vegas as well. I also have a first. I served 23 years on the city of Las Vegas planning commissioner, the longest serving appointed official in Nevada history. Throughout my 35 plus years of public service, as I was looking at options to retire, my son plays football at San Diego State. Go Aztecs. Number 26, Josh Goins, is about to retire and follow him and play football. And the neighborhood, like a village, called me and said, we need somebody to run the senior center. So we are a premier senior center with about 3,300 members. Of that, we have about 1,500 that are active on a monthly basis, 55 years of age and up. My dad's 94, suffers with dementia, and my mom is 90. And so my sisters and I made a commitment that we are not going to the assisted living. My dad always tells me, boy, I'll be here until I leave this earth and you make sure I'm here. And I said, yes, sir. And so we take care of them. Look at it this way, it's 3 of us, there's 24 hours in a day, so each one of us picks out our 8. And we make sure that mom and dad are taken care of. And so that puts me right in the wheelhouse of what the subject is today when we talk about Black men and brain health. One of the things, the biggest challenges I have at the center is trying to get our Black men to engage even in conversation. And so what does it take to get them there? We still have these myths that we talk about all the time about the old Tuskegee experiments, and these are reasons why we don't want to take that next step. But just like the doctor said, I start with a very simple directive, and I've learned it from my mother and father who are parents, and that's through education. And so we started through education, and we try to encourage our members to get involved in studies. Myself have volunteered for one of the Lou Ruvu Alzheimer studies because I want to be an example, and I want to set that example also for my son, who I know plays a violent sport. And he's concerned about the brain as he is, how come Papa got Alzheimer's, or how come Papa has dementia? And is it going to do it to you? And I told Josh, well, I don't know, but I'm going to try to get as much education about it. I'm going to volunteer myself for studies so that I can try to make it a little bit better on you and the generations to come. That's a little bit about me, and I'm looking forward to the panel discussion. Thank you.
You know, if I were to close my eyes and listen to him talk, I'm thinking Barack Obama over here. Like, what's going on here?
And if we got any members of Kappa Alpha Psi out there, yo.
All right.
Well, good afternoon. My name is Phil Kalsman. I'm with the Alzheimer's Association, based here in Las Vegas, sunny, beautiful Las Vegas, with the exception of this week. But listen, it's a thrill for me to be here with all of you today because I've been in Vegas for 20 plus years now myself, seen a lot of change, and I am thrilled to be a part of this cause, this movement, if you will, to raise up voices and to serve our community. My mom had Alzheimer's, and I come from a family, quite frankly, of medical professionals, and they could talk about the disease all day long, and quite often we did, but nobody knew what to do for her. Nobody knew how to talk to her. Nobody knew how to help her, communicate with her effectively. And so if we can do a little bit of that, help people along this road, because it is a long one for a lot of people, then we've helped someone. We've made the place a little bit better, our corner of the world, as they say. Of course, the Alzheimer's Association is funding research. We are advocating at the state and federal level for public policy that is meaningful and helpful for those suffering from Alzheimer's and other dementia. But our community connection is really where the rubber meets the road, as they say. And that's what we are so focused on here in Southern Nevada, not only here in Las Vegas, but throughout our community. Thank you.
Thank you. We're going to make sure that we open it up. Yeah, give it to him. We're going to open it up for questions in the audience, but I want to start off just a little bit, Diane, I have a question for you. I mean, you took us over yesterday. We saw this amazing facility, and you guys are doing amazing work over there. But you said, hey, listen, you're not even scratching the surface of the needs in the community. So from a clinical perspective and a research perspective, you saw our emerging scholars yesterday. What's the kind of the talent that you need here? What is the areas of need for talent to help serve the community?
So just in terms of direct service, we don't have enough of just about any medical professional in Nevada. So doctors, nurses, rehabilitation specialists, community health workers, we need just about everything, but particularly in brain science or brain medicine. So that includes neurology, neurosurgery, psychiatry. All of those are more underserved even than the medical community in general. And then we really need a lot more in terms of research. UNLV is building a brain health research team. We, of course, have a brain health research team, but we really need more boots on the ground, particularly in the community, Kat has been a stalwart for so long for us. I mean, I don't know what we're going to do with you retiring. We're trying to do things to fill her shoes, but we have come to realize that an open door is not the same as an invitation. And so, you know, I purposely did not bring a picture of our center today because our center looks crazy. It's a very unusual building. And someone mentioned today, it's not the type of place that someone looks at and automatically thinks that it's a place where they belong. You can have the door open all day and all night, and people aren't going to go in there because it looks like it's not for us. And so we are working much more towards the invitation and the degree of comfort that people feel when they get in. And so other things that we need, we have community advisory boards, but we need more community advisors to tell us, you know, what can we do to make this place look more inviting? What can we do to make it feel more comfortable once people get in here? We need people out in the community meeting with, you know, formerly called stakeholders, but really these are leaders of the communities, as well as those who form the root, like we heard earlier. We have a strong tendency to kind of seek out, well, who's the head of the heads of the churches? Who's in charge of the civic organizations? And I think we need to develop expertise in finding people who sort of are the base of the soup, the base of the stew, and not necessarily the star ingredient. It's new for us, relatively new, to really emphasize that, because we have relied a lot on the fact that, you know, we get a lot of press and things like that, and we just sort of have people come to us, and we have more people come to us than we can handle. So it's always been a little bit tricky for us to think about going out and actually getting more people, and then what do we do with them? But we had to come to the realization that the people who really need the help are not the people who are walking through these doors. And so people with expertise in recruitment, expertise in engagement, expertise in research about how to recruit and engage, and then of course, expertise to develop actionable information based on folks who do come and see us in the clinic and do join us for research studies. So I guess the sum is we need everything.
Okay, well, good. That's great for people early in their careers, or even people who are looking to move to another location that have these levels of expertise. They're saying that they're there. I'm going to ask across all three. You know, and I'm not asking you to speak for every community or anything like that, but what are some of the things that you are seeing, starting with Kat all the way across, in your levels of expertise and engagement in the community? What are some of the things that you are seeing in terms of how to either reach the Black community or engagement in the Black community, or their lack of a reasoning or interest in engaging with you?
Well, I like Dr. Wentz said, this has sort of been what I've been trying to do, knowing here at the Cleveland Clinic, we have all this wealth of knowledge. We have these resources. We have really great people who want to help people. And then I would go out in the community to educate people about brain health and go to the MLK Center and realize we're just like a mile apart. But that mile might as well be across the country. I felt like, wow, there's a group of people who could really benefit from what we know, right? From a professional. But how do we communicate it in a way that people get it, or they begin to feel that trust? I feel like that was always like, I want to build more bridges to understanding, to have ways we do communicate to one another, to realize and create that invitation feeling, right? And then I meet Byron, who's amazing, by the way. You should all go visit his center. When you get old, you want to end up at his place. Again, but that stress of education and it's you can't, I see it, you cannot go once You have to keep coming back, building trust, speaking in ways, having fun while you're trying to educate, play bingo and talk about it. I don't know, like all these exciting, things I just heard in the other panel. How do we really learn to talk to one another so we can understand? And for me, it's getting rid of the stigma of dementia a lot. There's a lot of suffering going on behind closed doors in this disease, particularly with caregivers, people who are afraid to tell their friends, their loved ones, I think something's wrong.
I agree. Doc, I just want to tell you something about that building. I was a chairman of the planning commission when we designed that. And there was a whole lot of architectural review and professional architect input on how that building would attract. But it does attract folks, but I didn't know folks were coming, that was not attracting those that needed the help to come in there. Kat mentioned we're a mile apart. She's absolutely right. But one of the things is just opening the door and come on in. And that's why the Martin Luther King Jr. Senior Center kind of modeled it after my mom and our house and what we've done in the community, as my mother and father, both longtime educators. My mom, 36 years as a vice principal, and my dad, 30 years. My oldest sister, a 34-year-old counselor in the school district, and my youngest sister, the mayor, just retired as a assistant principal. Come by the house. Mom's there. When you come in, we're going to greet you with a smile. She's going to ask you if you're hungry. You're going to sit down. You're going to get something to eat. She's going to ask you how your day is. The village, do you need anything before you leave? Can I help you? Those are the things I think we need to do to bridge the gap between institutions such as the Brain Institute and when it comes to seniors and their health. Sometimes seniors feel that they're forgotten and they're shoved in the corner. The kids are grown, gone out the house. It's up to mom and dad to do their own. We do it a little bit different. So when you come into Martin Luther King Jr. Senior Center, you're going to hear a little bit of Sirius XM Soul Town piped in. You may hear some Smokey Robinson going. You may see two seniors in the corner redoing an old line dance they learned from Chicago. But we keep that engagement in there. But one thing that we do is I keep resources consistently in and out of the center. I'll give an example. I have 4 Medicaid, Medicare brokers that are actually members of the center. They come up every day to do their bingo and sewing, but they also sit and review the plans of the seniors in the center. And this is not a sales call, so nobody's trying to get clients. What we're trying to do is make you understand what your policy is, what it affords you, and all of those benefits thereof. And one of those things is when I'm walking down the hallway and I see a senior grab the wall or I see somebody leaning, I do open that dialogue. Is it a balance problem? What's going on? Mr. Goins, I lost my keys. Where are they? We find them two hours later. They're in the ignition of the car. And so these are things where we pull in and we have to have those conversations. The good thing about it, I have 2 parents that I've gone through this. So I'm able to kind of have that barrier of communication broken. And then we get to talk about things that really do happen. But the main thing is to have a resource for them to go to when that decision happens. And I think brain institutes, I think Alzheimer associations, we've got to get out the office. We've got to put the boots on. We've got to walk into these neighborhoods, and especially in the Black neighborhood. Because we're kind of used to right now, as you know, it's the political season. So we're kind of used to that politician coming around every 4 years when they want something. And so what we try to do at the center is keep those resources available on a daily basis so they're accessible.
Great points. Studies clearly show us that people who are diagnosed with Alzheimer's or other dementia want to be involved in their care planning process for as long as possible. The problem is getting to that point. And there is the stigma word that Kat mentioned earlier. It is huge, and it is different in different communities because of culture and communication. We have to start the conversation, and we have to be deliberate. It wasn't so long ago that we didn't talk about the C word when someone was diagnosed with cancer. But organizations came along and they started educating, they started dialoguing, and they got women to go get their mammograms and men to talk about prostate health and things that we would have never discussed years ago that are now very commonplace. And look what it has done for our community. And we're at the same place right now with brain health. And I think, and I say this with all due respect to my colleagues at the Alzheimer's Association, we've done a really good job in the past of sitting there waiting for that phone to ring and providing incredibly good service. But now we are more focused in getting out and making that phone ring. We have got to get out and do the grip and grin, talk, knock on the doors, and engage in conversations so that we can start raising the awareness. And when we do that, we know that we're going to decrease the anxiety around it.
Thanks. I got one last question before I open it up to the mic. But Byron, you said in the Black community in Las Vegas. What does the Black community in Las Vegas look like?
We're here. Yes. Well, the Black community in Las Vegas, we are a proactive community. We are a close-knit community. In the area that I grew up and served on the Planning Commission, within a 5-mile square radius, there's 95 Black churches. And so, yes, and so we are there, we are vibrant, we are engaged, we are a vocal community, especially when things affect our communities directly, of course with our youth. And also right now, what's a big alarm bell is our seniors and rents. And so we have a number of seniors that are now, and we actually use the senior center as a community meeting place to discuss some of those issues as well. But the Black community here is live and vibrant, and we are very proud of our heritage here as well.
All right, can we get the microphone? Is there anybody have questions? Do we have a mic out?
Questions?
Byron, I just want to say the Noops are in the building.
Yo, yo.
Yo, yo. So this has been a phenomenal conference, but one of the things that I just kind of noticed, and this isn't necessarily pertinent to you, but I think it's something that everybody on the panel can kind of, just sort of address, because I kind of feel like it's two ships passing in the night, where you have like these community people who are doing these wonderful things and stuff, but then you also have these research institutes that, they get the grant money and they lament like, well, we wish we could do this or that or this and a third. And when you see some of these endowments and you recognize the need, the question becomes like, what is the barrier that stops, like, just for instance, like the Cleveland Clinic working like intimately with the Martin Luther King Senior Citizen building of stuff, where it's like, okay, well, you got the people who are familiar with the community, who are doing the groundwork, who are present, who do resources, and then you got a place that has like all the medical research, even if there is a paucity with neurologists and neuropsychologists and whatever the case may be. But it seems like it would be such a good partnership, and not just pertinent to you guys, but just overall, just speaking with all the institutes and whatever. It's like, what is that barrier that prevents like just the intermingling of the two things?
Well, I think the inception, it started with the relationship with myself and Kat. And so, and then just a little bit about our last 2 years, and from that, there was a gentleman, Mr. Brian Brown, who during this same time last year was on a panel, who became a trusted confidant and spokesperson for the center when it came around brain health. But how do we get to the table? We need folks like Kat that walks in our door, that makes those relationships so that we can then take it to the next step if we have to look at funding and things like that. And just a little bit about Kat, since she's not with the Brain Institute anymore, that didn't stop our relationship. And so she came over, and now Here, and I told her she's going to have a hard time competing at the center because on Tuesdays at 10 o'clock is Bible study. And if anybody knows black folks that do Bible study, you don't interrupt that. But we introduced mind and meditation. And some of the black folks looked at me when I said mind and meditation. Byron, what's wrong with you? Now, you know, we're not for to sit down here and sit no counsel, and we don't do that. And it was one of those discussions. But right now, my mind and meditation class runs parallel with Bible study, and I'm averaging about 8 or 9 folks in mind and meditation because we were able to get them in there through conversations and explain to them that this is not a black or a white thing. This is a brain thing, and everybody has a brain. So I think to bridge that gap, it's just developing these relationships, keeping these relationships close, and being able to show some data and proof of what we're doing with these programs.
Right. And I'll just add, I have found in this relationship that, you know, when I was first starting out at Cleveland, oh, wow, we have this great study. Oh my gosh, everybody's going to want to be in this. Like, what's the problem? And, you know, to run in with, hey, I got a research study that's government funded at an institution, and every one of our flyers at that time had somebody in a white coat, literally, right? And so it was wonderful. We had a community advisory board group form, and they shredded our outreach material. And that was my first, like, wow, okay, we've got to bring everyone together. White coat institution meets community member, and we revised this outreach research document that everyone could agree on, that really represented the diversity and the feeling of what both parties really want. And to go into the MLK Center, it's about relationships. It's really about making a good relationship, not coming with an ask. I feel like the community is just constantly asked for something, coming with a service. Hey, let's try meditation. Let's talk about your brain health through an activity. And just doing that thing, I got more of those people asking me more and more questions about dementia. Well, what's going with my brain? What does it look like? And so starting a conversation in a real, I don't know, human to human way, I would love to see more of that ability and people to do that kind of thing.
Yeah, we have another program. When you talk about collaboration, we work with AARP and we call it Walk with a Doc. And so what we've done is we've taken the doc, that person in the white coat, we've taken that white coat off, and once a month they're at the senior center. We have a group of seniors. We get out and we take a 2-lap walk around the center. And then we have a topic that doctor talks with. And after the walk, we sit down and we do a version of chair aerobics. We do a cool down. We work with Intermountain Health as well, which provides the doctors. And then we're having a conversation with a doctor. And this doctor doesn't have the white coat and the stethoscope. They're in a jogging suit with tennis shoes, and it's real relatable when they're actually the ones that are leading the stretching exercise or giving the best advice for a senior. And those relationships are golden within our community.
As to barriers, one I think is, you know, we talk a lot about the need to get out of the ivory towers. I think we really like being in the ivory towers. I mean, you know, most people like being in the places they're most familiar with. A second one is assumptions. You know, not everybody is interested in the relationship between hippocampal volumetrics and, you know, Hamilton anxiety ratings. Assuming that what you want to know about is what anyone would want to know about, including those in the community, that's almost always a bad assumption, and actually going and finding out what people want to know about. And then another one is lack of education. And I mean by that lack of education inside of our institutions, that we underestimate the importance of doing this for the good of science, for the good of medicine, for the good of the communities in which we all live. We're not really educated about the fact that people, they don't lack healthcare literacy or willingness to engage because they like not knowing or because they don't want to engage with us is because we don't give them the right opportunities to engage. We don't offer them a product that they want to engage with. You know, like we were talking about the white coats on the posters. That's just classic, right? Anyone ever heard of white coat hypertension, white coat anxiety? And then you say, hey, come see us in the white coats. It's just, it's kind of nonsensical. And yet we don't sort of take the time to educate ourselves about what really works and what we should be doing. And then I guess the other thing I would say is, you know, you mentioned hearing from some people in the community and hearing from some people in institutions. I heard from 2 women this morning who essentially are running community-based institutions, that they're doing research in Harlem and in Chicago that is community research. I mean, it's research on the behalf of the community, largely being conducted in some ways by the community with these institutions as their instruments for learning about things that the community wants to know. And I think that that's a really good and maybe the only right model for doing research.
Yes, we have a question in the back.
My question is going to pick up from Robert's point. If you could describe your community in one word, what would it be and why? And I believe Mr. Byron started that. So if you have anything else you want to add, feel free to do so. But I just wanted to hear the perspectives of each of the panelists, given that you are you're natives of the area, and you also contribute to what the reality of Las Vegas is to you. So I just wanted to piggyback on your thoughts on one word and why.
My one word would be vibrant, and I would say because of progression.
I would say engaged. I think there's just such a strong curiosity in this community to learn and get engaged and find a way to do so. I think people continue to strive to find that.
We believe. Look what Las Vegans have created for the rest of the world. I sense that in the communities too. It seems like and this is 25,000 words, that we're a city of transplants for the most part. Somebody is usually from somewhere different, and that's the problem in aging when you move away from your family to go somewhere warm. But that sense of can do, and we're a little bit rebellious, Las Vegas. We tend to, put up structures in a record amount of time and create people. And the people that work and live here, they have that same sense of, well, we can do it. We really can. So I believe it's a great place for brain health. It's amazing, kind of juxtaposed to partying, but it's a great place. I'm so excited about being in the city and what's happening in our community that will impact the rest of the world.
One word.
One word. It's hard.
Adolescent. New, it's a relatively new city. The land has been here, but there hasn't been a substantial population that is dedicated to itself as opposed to just to tourists. That hasn't been here for very long. Still not quite sure what it wants to be when it grows up, and trying on a lot of different things. It sees things that the grown-ups, New York, Philadelphia, have, and it wants those things. But isn't quite sure how to go about getting them, and also not all that interested in listening to its elders, always trying to find its own way. But just like the other panelists said, it's energetic, it's vibrant, it's progressing, it's moving, it's changing all the time, and I think that's really fascinating. But just like a teenager, really fascinating, and that it's going to be great once it gets there, but God, it makes you so frustrated sometimes.
Any question?
So I'm coming from Louisville, Kentucky, and they are building a hospital in the west end of Louisville, which is like the first hospital that they're built in the West End, which is a predominantly Black neighborhood in like 150 years. And so it's a great time, great opportunity, a lot of change in Louisville. However, the hospital is only going to have 20 beds, inpatient beds, and only going to provide about 4 services. So cardiology, primary care, endocrinology, and one other one. Unfortunately, I'm a neuropsychologist, so there's no neurology services going to be there. So I'm like, oh, boo. But thinking about the needs of like the Black community, like we're talking about hypertension, diabetes, all of these different things, which lead to cognitive issues and possible dementia. And so I'm curious to know or get your opinion on why not having neurology in a service when there is such a need and we see these, risk factors and all these things. But then also from a healthcare dollar perspective, we have wait lists for neuropsychology evaluations from like 7 to 8 months for dementia evaluations in the city. When I was at UVA, it was 7, 8 months, almost 2 years. So it's something that's happening everywhere. I'm sure we could ask anybody in here, and the wait lists are long. And so what can we do to go back to our cities or respective places and like help advocate on a policy level to the state to say like, hey, things need to change because the health system is not set up to where we can actually get the patients in fast enough and actually do the services that we need to do. So I just wanted to get your perspective from all of you on that.
Let's start with us, Phil.
I think that your frustration is probably something that is felt around the country in many communities. And I don't have an answer. We at the Alzheimer's Association are very focused, again, on public policy at the state and federal level. And all I could do is encourage you to contact the office in Louisville and see if there's some pending legislation or if there are recommendations that are being worked on that will help lift your voice and your concern to the folks who can make a difference.
Dylan, do you have any thoughts on this?
I was going to say nothing because I have nothing good to say, but I changed my mind. Our state has actually been very, very supportive of our center, but that's almost entirely, I think, on the basis of a personal relationship between our main donor and the whole government of Nevada. But that being said, maybe the best strategy is to find an advocate who has a lot of power, which usually means either political money or political influence, to really be the champion for these efforts. I think before I went to medical school, I've been hearing about the need for more brain scientists and brain doctors and so forth, which of course made me go to medical school to become a trauma surgeon. But I got hooked once I was in medical school. But it just seems like everybody has been hearing this forever and just kind of ignoring it. So I don't know. I really don't know what else to do or what else to say to get people to see the problem. And, as soon as one of their loved ones gets sick, they're all about it. But short of that, it just doesn't seem that there's this willingness to make a sustained effort to improve brain health in this country. Perhaps it's because in general, health in this country is sort of viewed as a series of events rather than something that you're either enhancing or detracting from every moment of your life, right? So we have this very episodic view of healthcare, which is not really healthcare, it's illness intervention. That's it.
Other hands?
Any questions?
Oh, can I just say one thing about the advocacy part? The Alzheimer's Association has done an excellent job in the advocacy area. They're very well organized. It's easy to participate. They make their advocates feel very welcomed. Training, you're given a lot. You don't have to remember all your civics and things like that. They really do a wonderful job of really helping advocates go to our legislators and tell them what we need. It was such a rewarding experience. I did this for the association, was the ambassador to Harry Reid, because he was here in Nevada. And I went year after year, and he was the majority leader, right? And so I was very naive and, gosh, this disease is so bad. And I would get the runaround, right? A little nice runaround. Oh, but if I give to Alzheimer's, then I can't give to such and such. And then we have this disease and that disease. Finally, one day, one advocacy forum, we go all march on Capitol Hill. We have purple sashes on. It's quite an event. And Harry Reid, here we are in his office overlooking the mall. And it was delegates from Nevada, old, young, all of us. And we all told our stories. And then Harry Reid finally looks at me and he says, one of my dear friends, longtime attorney friends that I've known forever, I just went to see him in a dementia care facility. He had no idea who I was. And it was so shocking to him to really experience, finally, what Alzheimer's disease could look like. And after he said that, he looked at me, he said, "What do you want? What do you need? What do we need to do?" So just keep going. I don't know, it is really a process, but it's important that people who experience really raise their voices about what we need.
Any questions for our panelists?
See your hands over in this side.
I shared this morning my work with brain health and chronic disease, but now I'm in what I call my second act, my second act. So my collaborator, Ronnie McClintock, she started a co-learning group. And we started talking about our second act in life. Our tagline is making your second act remarkable. So we have signed an agreement with UNLV and the University of Notre Dame to start what we're calling an Encore Entrepreneurship program here in Las Vegas for people who are over the age of 55. I don't know if you all know this, but 51% of companies throughout the United States are run by people over the age of 50. So I'm more interested in productivity, even if you're having some memory, because when we talk about brain health, it can run the gamut from just, I can't remember something to really being debilitating. So I'm happy to announce that we will be starting this Encore Entrepreneurship program at the Martin Luther King Center, which Byron runs. And I'm very interested, Byron, in doing some kind of research at the center with quality of life for people who are aging before they come into the entrepreneurship program and after they leave. This is groundbreaking stuff. It's not being done anywhere else in the US. And so I think when we talk about community, this is something that we can do in collaboration with Alzheimer's Association, with the Brain Health Institute, with the MLK Center leading the way.
You have any comments on that?
No, we're excited and looking forward to this collaboration. As she mentioned, at the Martin Luther King Jr. Senior Center with our activities, we have a lot of things going on from our sewing, and we have some pretty unique individuals there that do things. So we pose the question with seniors and the workforce and entrepreneurship, and it's something that they want to pursue. So I have a lady that sits there for about 6 hours a day with Crocs shoes, and she puts rhinestones on them meticulously. And I can't tell you the amount of orders she has. I told her she's going to have a factory working out at the senior center. But we're looking at opportunities like that to get seniors involved, and they're excited about it, to be their own business, even to subsidize some of the fixed incomes that they're on. So we're happy to work with Ms. Norman and Ms. McClintock on this initiative. Thank you.
We have a question from this gentleman here.
Yeah.
Hello again, everybody. I'm Michael Tapman from The Good Life. I have more of a comment that I guess can go into a question. The program that we do is called The Good Life, right? We started off, it was about to be about dementia and diabetes, and COVID happened, so we had to make everything online. Now we still involved with the Alzheimer Association, but my point is, we offer a bunch of different classes, right? So Wednesday and Fridays, I got classes from 11 a.m. and all our classes, you can go to goodlifepath.org. So especially for you, my brother, but we work with the seniors. So from 50, the oldest person we got is 95. So Wednesdays and Fridays is my class that's more of a unisex class, but it's mostly women. And all these women, like I said, is 50, my oldest is 95. So I average anywhere from 30 to 50 participants online every Wednesday and Friday. And we've been doing this for almost 4 years. 2 years after that, we started a men's class, which is why we here, right? Craig got the barbershop talk. I also do a workout class for the men. The highest number I had so far in my men's class was like 7 participants compared to the 50 of the women. Yep. So my point is what is stopping us men to get like these women, and as far as collaboration, we got a boatload of seniors, so it'll be great partnership. Like I say, everything we do online, we got a cooking class that she do. With my class, I give them all kind of workouts, hand-eye coordination, balance, flexibility. I also do fun facts before the class where we talk about healthy topics, diseases, infections, whatever it may be. So we get knowledge at the same time. But again, for the brothers, it's hard getting them there. And, Craig started the barbershop talk and he got brothers there talking now, but it's still hard to get the brothers there. Like, he have, when we got guest speakers, he have anywhere from 20 to maybe 30 brothers, tuning in then. But if it's not a guest speaker, the number is down a little bit. So it's hard to get the brothers to talk, but the brothers don't necessarily want to work out either. So what is the issue with us of, working out or wanting to get this knowledge or whatever the case may be that's stopping us from moving forward is my comment and question, I guess you could say. Thank you.
You're exactly right. I have that same problem too. As a matter of fact, I'm trying something new for Super Bowl. So I've invited all the men from the Martin Luther King Jr. Senior Center up to the center on Super Bowl Sunday. I've got barbecue, I've got beverages, I've got everything. And it's not going to cost them anything. So I'll see what's going to happen on Sunday. But also at the Martin Luther King Jr. Senior Center, this is for everybody, I am a very vocal about technology. So our programs are on a virtual platform as well. So not only are the seniors engaged as they come in, but those that have challenges that can't get to the center anymore are still able to engage our programs via online platforms. So we have one Zoom meeting ID and link that we use for all of our programs. We've also partnered with other online communities involved with seniors. One example is Televeda, which is out of Arizona State University. Those virtual classrooms or virtual classes and activities are on a virtual platform. So we're able to log in to bingos on Tuesday, tech Thursdays, we log in as well. But I do welcome that from organizations like yours as well. Another thing, when we talk about Black Man's Health, that I have 2 chefs, so I have a commercial kitchen, so we cook every day at the center. In 2018, when I took over, I remember I walked right in the kitchen. I have a chef, Miss Chef Archie. She's from Louisiana, God bless her soul, family of 16. So some of y'all Black folks know where I'm going here. So she was in there using a thickener one day, and I said, well, Miss Archie, what is that? She said, well, that's a little vegetable oil and flour. I said, well, Miss, what you mixing that together for? Well, that thickens it up. And my cholesterol levels just started moving inside me, and I didn't have to say nothing. So one of the things I sat down with her as one of those old school black cooks, I said, you know what, Miss Archie, there's some other ways you can thicken things up without using this vegetable oil and a little gold medal flour. And so when I look at Black man's health and our health overall, it's about nutrition as well. And so we have to make sure that we are putting those brain healthy foods into our bodies. And some of these old myths about what we eat, in the Black household, a lot of those things that we eat, and we have these discussions all the time at the senior center. Some seniors said, I ate that because I had to. We had no other choice. When I was growing up in the 50s and 60s, and my mom was, and believe me, I still have some seniors, they parents were slaves. And they talk about how this part of the pig was all we had, and this is what we had to do with it. And so now we fast forward and look how that affects you nutritionally, and look at the balance in your diet. And so I sit down with my chef, and we make heart healthy meals now. We may spoil you every now and then, because I'll put a baby back out there on the grill now. Don't get me wrong, but it's all in moderation in what we do. So we're clean and healthy eating at the center as well, and I think that's very important.
I saw a couple hands out there.
Any questions for the panelists on Alzheimer's disease and brain health in Clark
The
County?
brother with the blue shirt on there, right there,
Bro-
right here. Right,
Blue shirt?
Yep, to your right, right there.
Oh, yeah.
Hey guys, how you doing? My name is Giovanni Trilleris. I own the largest forensic pathology group in the country. Neuropathologists, also included in a group, we got about 70 of them. So in a comment you made earlier about getting someone with political power to potentially advocate for either more funding or prevention, have you guys done any sort of collaborations or research with the Clark County Coroner's Office, on causes of death and the statistics over there? And the CDC typically tends to listen a lot to the medical examiners and coroners around the country on what to focus funding on and how to get better prevention in the community. So I'm just wondering if there's been any sort of attempts to kind of work with them at all.
That's a great idea, and there haven't been any that I know of sort of directed at examining the causes of death in Clark County and getting government to approach it from that perspective. I'm curious about whether there's been any engagement with your company or any of your pathologists in that regard.
Yeah, so we work with about 40 different states and counties around the country, and routinely we're getting asked by the CDC, either our doctors or the communities, hey, what's the number one thing we have to focus on next, and what do we have to spend more money on now? So over the past few years, it's been fentanyl has been the biggest thing around the community, and we see the end results of a lot of what happens. And the coroners, the chief medical examiners, they're always looking for, hey, what are we missing? What are we not focusing on? How do we prevent people from getting in here unsuspectingly? And so, having many doctors that work at Clark County, or knowing the coroners out there, they're always trying to see, hey, what aren't we listening to? What aren't we missing? Why do people keep coming in here, and how do we prevent that? There's been certain, Bennett Omalu is a big neuropathologist who worked with the NFL to help, recognize CTE. So I think when people start to look at the end result and put more focus on how do we stop people from getting there, I think people tend to listen a lot more as well. I know government tries to listen to it, but I think, in collaborating with them, there could be an opportunity there. Just a thought or comment, something to think about.
Yeah, I like the idea.
Sounds like a research opportunity to me for all these research scholars in here. Get on that. I saw some other hands.
We have one question here from the gentleman.
How you doing? I have two-part question. What is the recruitment process when you go to these communities and you contact these leaders who can pull the people together? What is the process of educating them so the trust process can begin with them to you? because one thing we haven't talked about is trust. It's not because we don't know, it's because of what we heard, like Brother Byron talked about as far as the Tuskegee instrument. We just be stuck in a certain mindset that prevents us from moving forward. And the second part is, how early do you start the research on dementia and Alzheimer's? Because one of my podcasts, we talked about dementia being as young as 16, and CTE starting as at the Pop Warner stage. So how low do you go to start this this fix that we need so badly?
So I'm going to say, especially from the whole recruitment and engagement, I'm wondering, particularly, just to paraphrase, what are your strategies, particularly in terms of to be culturally informed, working here locally in the community, from the Alzheimer's Association perspective and from the Cleveland Clinic?
So I'm not the person to deliver the message, right? I am interested in finding someone that I can build that relationship with, build that trust with, who can become our champion, become our voice, become the person who can then work with the community and deliver the appropriate messaging. It is crucial to do that, and we respect and recognize that from the very, very beginning. Otherwise, we're talking to a wall, and it's disrespectful, frankly, to the community that we're trying to work with. So we want to recruit community champions who can own this message and have it become their opportunity, if you will, to build lines of and bridges of communication. You mentioned earlier about men not networking well and men not like women do. And a lot of it is trust, but a lot of it is too, men just don't do that as well as women do. Women network very well. And so it takes a little bit longer sometimes to build that trust and to find that champion. But I'll tell you what, when you find someone who's gone through that journey, they just want to do anything they can to prevent somebody else from going through it too. And there's that low-hanging fruit. There's that passion, and we're doing everything we can to work with anyone we can who wants to join us and be a part of that message.
Phil, do you know if there's any lessons learned or practical things that you're doing that you could share with us in that realm?
Well, I think that's a great question. I think just, yeah, the practical thing is we can't go knocking on the door and expect people to want to talk to us, especially about dementia and Alzheimer's. This is not a fun topic. So it's I think Kat brought it up, being able to provide a service and being able to provide an invitation rather than just opening the door and expecting, oh, well, here I am, let's chat. We've got more work to do than that. I hope that answers your question.
Okay, Kat, do you have anything that you want to add to this?
Yeah, I think I learned a lot along the way with that. This whole concept of how do we create this bridge, this trust. A pivotal thing, as I mentioned before, was creating this community advisory board that we had for one particular project. And from different members we have a very diverse community here in Las Vegas, and just having those voices tell us as a kind of institution what we were doing wrong, why it wasn't inviting, and talking about the barriers to participation, transportation. A lot of our studies require a study partner. That means somebody's got to get off work and probably not get paid that day. Like a care partner has to come and take your person. The time commitment, yes, that historical fears of, I don't want to be anybody's guinea pig, right? So, there's a lot of barriers to cross. I found it much more, I guess, a palatable or a conversation to have with creating the relationships with these board members. One of the board members, she's a queen in the Black community. Everyone opens the door for my friend. And once she realized I was a friend here to help, she literally took me to the shepherd's breakfast, a meeting of community church members, and held her hand up and held my hand up and said, "She's one of us. She's good." And it took that, like, member realizing I was somebody who really wanted to help. So again, it's back to sort of that relation building, and then meeting Byron, and it's a layer cake. It's 1,000 layers, just kind of over and over again. And I still am frustrated there's not more people coming to the center, but it's not a short conversation. It's a very long one, because there's a long history to undo behind there. And I'm hoping a younger generation is catching on that it's participatory in nature.
Go ahead.
With building trust, we tend to assume that we're starting off from zero, and as long as we don't do anything to kind of violate a trust overtly, we'll be okay. But we have to realize we're starting off from very often below zero, a stance of distrust. We have to get to zero, which is I don't have to fear this person, and then get to the point where now this person is a friend. So it's a longer process. And yeah, there's frustration that we're not getting people coming in. But if you focus on we are giving to, what are we giving to the community, and what are they asking for? They're asking for more, and we're giving more, then that's success. It's actually okay with me if we don't get a whole bunch of research participants and a whole bunch of patients, as long as we're giving people the help that they need, whatever the form is in which they need it, and whatever works best for them, assuming that it really is something that's helping the community. That's an okay outcome for me.
Byron, I'm going to kick it over. That last part of that question, we want to give respect to it, but real quickly, we've talked a lot about, older age brain issues, right? Dementia for older adults. But are there institutions, Black institutions that are here locally that reach across the life course, where there are young football programs or other programs where there are opportunities to engage and reach people in the community, other institutions and organizations?
Not that I know of. In the community. I'd love to be a champion of that. I know at the senior center, Kate used a word called guinea pigs. I try to tell the seniors it's important for them to be a part of it. And it's not that it's a guinea pig, but to me, to have the center there to be open and available for researchers to come in, talk. To me, it's all about education and educating the community. And one of the things I like to do also, which I am learning now, my mother had a stroke December the 6th. She's in the hospital now and I'm dealing with it. But one of the things that I'm seeing now is how important that family structure is, and pulling those young folks into this discussion as well. And so, but the center, my seniors are now of the mindset that we are ready to participate. So we're open to those studies. So we want to engage. We're ready to sit down and talk about some of those dark things in the past and those discussions that we've kind of brushed over. But in terms of a institution right here in Clark County, I know of none, but I'd be willing to champion and start one.
All right. Well, thank you. Well, let's give it up for him. Thank you so very much. Yes. I know, I'm saying it. All right, so we have a break now for, I guess, about 15 minutes. We're going to come back at 3 o'clock, and then we have a community workshop, partnership workshop. So thank you.